Hello, it's Eric, and this is Intern Crash Course. Today, I'm running through 10 quick and specific tips on how to be an effective intern, focusing on those specifically related to bedside care. First up, whenever possible, sit down when speaking with patients. You'll be more comfortable, and it gives patients the impression that you're spending more time with them. Next, learn something interesting about each patient that's not related to the medical problems or their medical history, and ask them about it. It could be a hobby, their job, an unusual place they previously lived. This will help to remind you that the person in front of you is, well, a person, and not just a walking collection of diagnoses. It also establishes rapport with the patient, which then results in trust. When a diagnosis has not yet been made for an acutely ill patient, ask them for their perception of illness. This includes two related but distinct concepts: what they think is most likely going on, and what they are most worried might be going on. For example, a patient might think their headaches are just migraines, but what they are most concerned about is the chance it's a brain tumor. The difference between needing one attempt at a lumbar puncture and 5 attempts is getting the patient properly positioned and palpating the landmarks. It's similar to what my woodshop teacher said in middle school: measure twice, cut once. This is true of all procedures, but is particularly true of LPs. Do not tolerate mistreatment by patients. If a patient makes a racist, sexist, or homophobic comment, either at you or at another member of the treatment team, and if it wasn't made during a period of delirium, intoxication, or psychosis, politely but firmly let the patient know that this is not okay. If you don't feel comfortable doing that, for example, if the patient is physically intimidating, let your resident or attending know what was said so they can address it with the patient instead. But don't just let it drop. While no one expects that a lifetime of bias will be fixed by a brief conversation in the hospital, it is impossible to treat someone objectively who is actively disrespecting you. Ask your patient at least a day before discharge how they anticipate getting home. You don't want to discover at 5 p.m. on a Friday that your about to be discharged patient lives 3 hours away and has no ride to get there. While you may not have time for every bedside task that comes up, no task is beneath you, or beneath any doctor for that matter. If your patient is cold, get them a blanket. If you just removed their NPO status and there's no food in the room, go grab a snack for them from the patient kitchen. If your patient's nurse needs to turn the patient, by all means ask them how you can help. Patients will recognize your efforts, but even more so, the nurses will, and they will appreciate it. When speaking to patients and families, always introduce yourself as Dr. So-and-so, and not just by your first name. You'll likely have the appearance of being the most junior member of the team. You want the patients to see you as their doctor and not as someone a month or two out of med school. Unfortunately, the need to introduce yourself as a doctor is particularly true for women. You will already get mistaken for a nurse far too often. As it is, using your first name with patients is only going to make that problem more common. In contrast, however, when introducing yourself to other healthcare professionals, such as pharmacists, physical therapists, and nurses, don't introduce yourself as Dr. So-and-so. To me, doing that feels a little obnoxious, even when it's coming from a very senior faculty member. But when it comes from when it comes from an intern who has just graduated, it's kind of cringeworthy. So instead, introduce yourself by either your first or your first and last name, followed by your role. So for example, if I'm meeting a nurse or a consultant for the first time, I usually introduce myself by saying, "Hi, I'm Eric Strong. I'm Mr. Smith's hospitalist." And last for today, for patients whose families are not routinely at the bedside, be sure to call them periodically to give them updates, as long as it's okay with the patient. Just because you've never heard from the family does not mean that they aren't wanting to hear from you. And it's not uncommon for families to leave messages for the patient's medical team that for whatever reason just never get delivered. So that's it for the first of these 10 tips. Future 10-tip videos will cover pearls about medications, rounds, the physical exam, and documentation.